Well, many people can go through periods of feeling down and not themselves, and that can come with the changing seasons. If you notice changes in your mood and behavior as the season changes, well, you could be experiencing seasonal affective disorder, also known as SAD. It's a type of depression that has been brought on most often by the fall or winter, leading to a chemical change in the brain that could lead to symptoms of depression. And joining me now is Dr. Kristin Raj with Stanford. Starting off, what exactly, for people who don't know, causes seasonal affective disorder and who is most risk of developing it?
Yeah, we don't fully know the cause of seasonal affective disorder. It seems to be something to do with the circadian rhythm shifting, a change in the sleep-wake cycle, and something to do with the serotonin transporter in some people. And the people most at risk are younger people, women, and actually people who are night owls are more at risk than people who are early birds.
So what are some of the symptoms of seasonal affective disorder?
Seasonal affective disorder is like any other type of depression. So you'd look for the same sort of symptoms: low mood, desire to not socialize. Some specific symptoms are an increase in appetite. People tend to get a craving for carbs, increased desire to sleep, stay in bed. Some people can have a more severe type where they're getting suicidal thoughts as well, in which case that's definitely a sign to seek out mental health care right away. But it can be similar to any type of other depression. Another group of people, maybe 15 to 20% of people actually get winter blues. So not quite as severe as seasonal affective disorder, but sort of that just lull in mood, not wanting to do things, staying in bed. More people can get that.
Do you see it as a regional issue too? I mean, here in California, maybe we have a little more sunshine. I used to live in the Pacific Northwest, and as you and I were chatting earlier, we had one stretch, it was like 30, 40 straight days of rain. Do you see it happening in different regions more often than others?
Absolutely. There tends to be an association as you get further away from the equator, more people get seasonal affective disorder. So just like you experience in Seattle, probably more people there than in the Bay Area. But we're getting this stretch with a lot of cloudy days here. And so I imagine some people are experiencing that here as well.
And so how do you treat seasonal affective disorder?
You can treat it similar to other types of depression with medications, psychotherapy, but one unique treatment to seasonal affective disorder is light therapy. So that's where people, and you were talking earlier about seeing some friends at work, maybe having a light box where it's emitting a really strong amount of light from it. And in the winter, when it's really cloudy, we're not getting as much strength from the sun. And so having a light box that's emitting this really strong light, usually around 10,000 lux, using that for 10, 20 minutes in the morning can be really helpful for treating it.
Yeah, and that is true for people who didn't hear our conversation earlier. Yeah, there was a couple people at my station in Seattle that had those UV light boxes at their desk. Also, some of my friends had, was it salt rock lights? And then also, I also heard that, does vitamin D help?
People are wondering about vitamin D. There hasn't been an explicit study using vitamin D to try to treat it, but we do know that people have lower vitamin D levels when there's less sun. And so some people try vitamin D to help as well. Using a light in the morning, even before you start to wake up, it's called dawn simulation. So starting that light, they sell specific types of lights that do this, that start to light while you're still asleep. And your brain's starting to realize, okay, it's dawn, time to wake up. It both helps people get out of bed and can help with seasonal affective as well.
Well, always good information from Stanford. So Dr. Kristin Raj, thank you very much for joining us.
Thanks for having me.